Hello guys, today I am going to discuss about the Digeorge syndrome. It is also known as 21q11.2 deletion syndrome. And why is it called so? We all know there are 23 pairs of chromosome, out of which 22 are the autosomes and 23rd is the sex chromosome deciding the sex of the fetus. And the chromosome consists of genes. So here I have marked yellow lines for indicating the genes. What happens is in the chromosome number 22nd, addressing it as 22, Q stands for the long arm. 1 is the region, and then again 1 is the band, 0.2 is the subband. This is the address where there is a deletion of small part of the chromosome. From this place there is a deletion of a small part of the chromosome, so we call it as 22q11.2 deletion syndrome. Although there is a deletion of a small part of the chromosome, still it consists of TBX1. And what does this do? The pharyngeal pouches, the pouch 3 and pouch 4. Pouch 3 has the function of thymus plus the inferior parathyroid gland, and pouch 4 has the function of superior parathyroid gland. But in the Digeorge syndrome, as there is deletion of TBX1, so these two will go under hypoplasia. So what is the mechanism of thymus in Digeorge syndrome? The T cells or the T lymphocytes, which was converted into mature T cells with the help of the thymus, it won't take place as this function will be absent because of, as I said, hypoplasia. So there will be, as a result, deficiency in mature T cell. So it can be partial or complete. Partial is like the mild or moderate dysfunction and it is not life-threatening. And complete can be severe dysfunction, which is very fatal and compromised of the immune system. Then what is the mechanism in the parathyroid gland? The main function is the secretion of the PTH, that is the parathyroid hormone, that increases the calcium level. But if there is hypoplasia, this function won't be there because of hypoplasia of the parathyroid gland, which will lead to, as a result, hypocalcemia. There will be decrease in calcium level. What clinical signs we can find? In heart, the congenital heart disease like the trancus arteriosus, tetralogy of the Fallot. Facial abnormalities like the cleft plate, facials like long face, small teeth, broad nose, behavioral and mental disorders like schizophrenia. Here I have given a picture of a patient of Digeorge syndrome. Here we can find he has small ears, broad nose, long face and small teeth. So the diagnosis is mainly done by the genetic testing, and we can also go for blood test where we find the number of T cells, calcium and the parathyroid hormone. Treatment is not yet known and not yet very curable, but we can manage the symptoms. Like if there is infection, then we can go for the antibiotics. If there is hypocalcemia, then we can go for the calcium supplements and vitamin D. Surgery is very rare and done only for severe cases. Surgeries like thymus transplant and heart surgery should be done only if the patient is having severe symptoms and conditions. So this was the definition, mechanism, clinical signs, diagnosis and treatment of Digeorge syndrome. I hope you understood it. Thank you.